Perhaps you were born for such a time as this.
Hello, everyone, and welcome to Faith and Freedom. I'm Shemane Nugent. You know, there are a lot of questions right now when it comes to cancer. Used to be, I couldn't even say that word. I got banned for it. But what people are calling turbo cancers and what may be changing in what patients are experiencing too. We're going to get into all of that in just a moment. But first, a groundbreaking new study shows that there is a safe and inexpensive potential cancer treatment, and it's a drug that many of us already know about, ivermectin. Couldn't say that a few years ago. This new study shows that individuals who took ivermectin, the parasite-fighting medication that gained fame during the COVID pandemic, along with the drug mebendazole, saw remarkable results in their battles with cancer. Now, this incredibly promising results that many Americans have been experiencing, they're also wondering where they can obtain ivermectin, American-made ivermectin and mebendazole. And that's where my sponsor, the wellness company, comes in. You see and hear from TWC doctors all the time on this network, and you know that their products are the gold standard for keeping you and your family safe and healthy. The wellness company is making 100% American-made ivermectin and mebendazole available for you to RAV viewers at incredibly affordable prices. So say no to Big Pharma's greed and yes to ivermectin and mebendazole through the wellness company. You don't want their poisons from Big Pharma. You want to say yes to a company that you can trust to bring you safe, affordable, and effective treatments. So if you or someone you love is interested in trying ivermectin and mebendazole, then you gotta go to twc.health/Shemane today and order. That's twc.health/Shemane. Now don't forget, use that promo code Shemane to save 10%. Joining me now is Dr. Peter McCullough, cardiologist, epidemiologist, and one of the most published physicians in his field. Dr. Peter, welcome.
Thank you.
So we've been talking about cancer the last couple of weeks here on Faith and Freedom, and I wanted to continue that this week. But first off, we've been hearing a lot about turbo cancers. Dr. McCullough, can you explain to us what a turbo cancer is?
Turbo cancer was coined during the pandemic. It's the observation that a cancer is occurring at a younger age. It is more severe at presentation, and it's progressing at a more rapid rate. And we've seen examples like former Dallas Cowboy great Deion Sanders had a bladder cancer in his 50s that was growing so rapidly, his entire bladder had to be taken out. I can tell you, I've had 4 decades of medical practice. I've never seen that before. So I'm seeing things in my practice that are unusual. In 2025, Time magazine, on the cover of Time magazine, said, where are all these cancers coming from? They're describing turbo cancer. And we think, Shemane, it may be actually related to the pandemic.
I'm glad you said that. I wanted to get into that a little bit more today. So with these turbo cancers, we're seeing a rise in them as well, multiple cancers.
Right. So multiple cell types in cancers. Now, the National Cancer Institute has said that colon cancer in men is the leading cancer before age 45. I mean, we're starting to see patterns emerge that we've never seen before.
So in the wake of the COVID-19 pandemic and the COVID vaccine, I hesitate in even saying that, Dr. McCullough, because I was banned on Twitter for talking about this. But how could the COVID-19 vaccine be responsible for a rise in cancers and, in particular, turbo cancers?
The vaccines, 81% of Americans took a vaccine, Shemane, and I want to be sensitive. I don't know if you took one or not, but I didn't take it. I never thought they were safe. But of those who took a vaccine, 94% took a genetic vaccine. That is a messenger RNA vaccine from Pfizer or Moderna. And there were data from China early suggesting that synthetic messenger RNA could actually impair DNA repair and maybe oncogenic. Then an important paper by Bustos was published in the journal Curious, Journal of Biomedical Sciences, saying there were multiple mechanisms by which these genetic vaccines could actually cause or promote cancer. And, the messenger RNAs completely skipped the oncogenicity preclinical studies. So the companies never knew if they were going to be safe from a cancer perspective. And now here we are, we're left in this dilemma. I think the commonality between the infection and the vaccines is the spike protein, or the tip of these little sticks on the surface of the ball of the virus. The spike protein has been shown in a modeling study from University of Pittsburgh to lower our defenses against cancer, our tumor surveillance systems, P53 and BRCA. So what I'm telling you, by multiple mechanisms, the pandemic virus, SARS-CoV-2, and certainly the COVID-19 vaccines, they are probably responsible for this wave of turbo cancers that we're seeing.
To answer, I don't know if you could see my head shaking violently when I said, I was telling you, responding that, no, I did not take the vaccine, but I do want to be sensitive because I know I have a lot of family members and friends that took it. And I want to know how we got here and why has so little time and money been spent on cancer prevention?
The National Cancer Institute is almost entirely devoted to treating cancers, and particularly advanced cancers. And the traditional methods are surgery, chemotherapy, and radiation therapy. And while there has been progress, it's been very incremental. And there are very few studies of preventing cancer. There's been some studies of aspirin, in a low dose, preventing colon cancer partially. I think the naturopathic doctors have made progress in cancer prevention diets. There are some nutraceuticals and supplements that look quite promising, like curcumin and black sativa, cruciferous vegetables. But we have not had an investment in the prevention of cancer as we have in the prevention of heart disease.
And why do you think that is?
It's a very, very heterogeneous group of diseases. From one cancer to the next, they're very, very different. It's not like atherosclerotic cardiovascular disease, where things can be more simplified. So I think it's the complexity of cancer. Okay, we've learned a few things. Smoking is a risk factor for lung cancer. So if you don't smoke, the risks go way down. In fact, if you've smoked and stopped smoking after 5 years, the risks have essentially returned to not that of a non-smoker. We know that alcohol is a risk for throat cancers and esophageal cancers, but human papillomavirus associated with throat cancer, and then penile and vaginal and cervical cancers. But otherwise, there's very little insight. What is, the risk factor that's modifiable for pancreatic cancer or kidney cancer? Right now, it's unknown.
Well, I'm glad you're bringing all of this to light. And, there's been amazing results from the wellness company study regarding the treatment of cancer with ivermectin and mebendazole. So do you think that the off-label use of these antiparasitics could be useful in preventing turbo cancers?
It's possible, but right now, what we studied was the adjunctive use. So these were people with established cancers, in men, most commonly prostate, in women, most commonly breast, in both genders, lung and colon and other cancers. So they had already gotten surgery, chemotherapy, radiation. About a third were essentially in remission. A third had active cancer, and then some, it was actively metastasizing. There was an 84% rate after 6 months of this off-label use of ivermectin-mebendazole combination in benefit, holding the cancer the same, and in some patients actually the cancer regressed. Sadly, about 15 or 16% the cancer progressed, and it was a realistic study. About 25% of patients had some side effects, commonly GI side effects. But this is enormously important. Two anti-infective drugs which have preclinical data and some clinical data supporting its effect in reducing proliferation, reducing the ability of the cancers to grow new blood supply, and then accelerate apoptosis or clearing out of the cancer, that these generic drugs in combination, just like a combination chemotherapy, help patients with cancer by self-report. This is teed up perfectly for the National Cancer Institute, Robert F. Kennedy and his group, to actually do a large prospective double-blind randomized placebo-controlled trial.
Did you ever, we've only got about a minute left, 30 seconds left. Can you, in a short period of time, just tell us, what was it like for you being one of the first doctors to speak out about this?
Yeah, I was stunned with the results. We knew patients were trying. We were keeping track. We were shocked that, in fact, by very accurate self-report, we know this is preliminary. It's now conditionally accepted in a peer-reviewed journal. But this is going to accelerate cancer treatment development. I hope available generics do join expensive chemotherapy in helping people get better.
Well, I've got mine, and I've got many of the wellness company emergency kits, including, thank you for coming out with the positive, PAWS,
yes,
positive for our pets, because you would take your dog to the vet and it's $500 later for a scratch. But Dr. McCullough, I want to thank you so much for joining me. God bless you, and I hope you will come back again very soon.
Thank you.
Don't go away. We'll be right back.
Relish the opportunity to be an outsider, because it's the outsiders who change the world.
Perhaps you were born for such a time as this.